You know, we're all different inside and out, and that's the main reason why many doctors now take our own genetic makeup under consideration when it comes to prescribing medicine. It's called personalized medicine or precision medicine. Returning to the show once again is Dr. Wohlgemuth of Quest Diagnostics Incorporated. Good morning.
Hey, thanks for having me back, Olga.
No, thanks for being here, because today we're going to focus on personalized medicine. Hearing it more and more. Let's talk about that.
Yeah, well, personalized medicine is really the use of genetic testing or DNA sequencing to determine what therapies will work in someone and which therapies may not or may even cause side effects or toxicity.
So it's moving away from the trial and error approach that we've used for so many years, right?
Absolutely. It allows you to really determine in a person which therapy will work in advance, as opposed to trial and error where you try something and 6 months later to figure out it actually doesn't work.
And you've wasted all this time.
All the time.
And money.
Yeah.
And you could have had the answer a lot earlier.
Absolutely.
Doctor, are there any areas of medicine in which patients benefit from personalized medicine more so than others?
The area that really is picked up is around cancer.
Of course.
You know, people with cancer in the past would get a standard therapy just based on a population and 6 months later determine if it worked or not. So now what we can do is we can take the tumor tissue, sequence the DNA, and determine based on that which therapies will work, which therapies won't work, and which may cause toxicity. And really important information to optimize cancer therapy.
So that one size fits all is no longer. It's more of a target.
Much better approach to know in advance what may work before you undertake it. And it's not just a matter of cost, it's life and death.
Of course. What role does Quest Diagnostics play here?
Well, it turns out for cancer specifically that 70% of cancers are treated in community cancer centers or community oncology centers. And so we're able now to deliver genetic information to those physicians and patients in the community. And we do it together with IBM Watson, our partner, where we're able to crunch all the data that's needed to determine of all of these genes and all of these therapies, which therapy works given this gene, and also what clinical trial may be out there for a patient to enroll in based on their genetic data.
Again, more specific for the patient's needs and what that patient needs at that moment.
Targeted.
Now, for patients who take several medicines daily, does this help them maybe reduce those numbers?
There is an approach there that's highly beneficial in people with multiple therapies to determine which therapies will work, but also which therapies may interact and which therapies may cause toxicity. And again, it's all about getting away from trial and error. Because if you're on 8 medicines and you're trying one and you're trying another, and 6 months later you figure out your regimen's not working, you know, it's a backwards way to work. So now we're able to sort of do some work up front to try to optimize your therapies in the beginning.
So what would you say the future holds for personalized medicine?
Well, there are a lot of new tests coming and new applications, but really what I see is convenience. Making this much more convenient for people. So what you'll see in the future is testing available in grocery stores and pharmacies. You'll also see what I really like is home-based testing.
What's that?
Well, that would be a case where you're able to obtain a genetic test and have the box dropped on your lawn, just like an Amazon order. Take that box inside, collect the sample yourself, send it in, and have the results come back on your smartphone.
As opposed to waiting weeks and weeks to having to get it done.
Yes, and see a doctor and then go to another appointment. It really lowers the barrier to getting it done, and I think a lot more people will get involved and get testing done because it's just more convenient in the future.
And to always consult with your doctor first.
It's really important to consult with a doctor about what testing makes sense, but also to have that doctor available to help you understand, what do I do with this information when I have it?
Great stuff. Thank you so much.
Thank you, Olga.
Thank you, doctor. And if you'd like to learn more about this, personalized medicine, or how Quest can help you and your family with preventative health care, visit their website, questdiagnostics.com/patients, or go to our website, thebalancing act.com.